I think we have a few new people today. So if the ones who joined for the first time would like to just introduce themselves, it will be great. If not, that's okay too.
I think Vishal and Ruchi, um, we've had you for few of the previous meetings. So yeah, welcome back. Also, welcome to Dipali, Mrinal, and Smita. We're glad you could join this meeting. So if you'd like to give your quick introduction, it would be great for us to know about you and we can have this interaction going on.
Okay, hi Mahesh. I'm Dipali. I'm doing genetic counseling, like I'm genetic counseling intern in Newburgh.
Okay, great. Hi, welcome.
Thank you.
Hi, I am Ronalda Ate. I am an undergraduate student pursuing BSc Biotech and I'm quite interested in genetics.
Great. Welcome, Ronald. I'm glad to have you here.
So, Mrunal, how did you get to know about the Journal Club and how did you get to know about genetic counseling as a career option for you or as a field for you? If you'd like to talk a little bit about it, that'll be great.
Uh, Thank you so much for letting me speak. I came to know about genetic counseling through our alumni, Prachi. She gave us a very great introduction of genetic counseling, which intrigued me to learn more about it, explore it, and learn more future prospects of how does it turn out to be as a career.
That's amazing. That's great. Okay, so we have Smita and Riddhi also, I think, joining for the first time, as far as I can remember. So, if you would also like to introduce yourselves, please.
Hello, I'm Riddhi Patel and I work as a GC assistant at Newburgh.
Oh, that's great. Okay. Welcome to everyone who's joined for the first time. And so, just to give an introduction, that of course we talk about anything that is related to genetic counseling and just certain topics we think that maybe future students or prospective students could benefit from just knowing about them and just discussing them in general. And apart from that, this is an extremely interactive session. So we are not trying to teach you something or just, have slides and, all of that. So whatever papers, for example, if we're discussing a paper today, we'd very much like for you to maybe just skim through the paper or at least go through it as much as you can, not have to go through it entirely because it can be difficult to read a research paper completely at times, so it's completely understandable. But then we'd like for you to just put in your inputs as well whenever we were discussing something. And there is nothing wrong or right here. Even if you think you have to just ask something, just ask it out. It's okay. And there's not just one, but at times just two or three just industry genetic counselors with us in the meetings, so you'll get your answers regardless. So don't hold back on saying anything and don't hold back on asking anything during the meeting. Okay. And we can start if we'd like, if you want to know.
Okay, I think we can start with the meeting.
Yes, we can. Let's start.
Okay, great. Hi, welcome once again to everyone, and thank you, Sukriti, for introducing the journal club to the members and uh, letting them know what is the aim and motto of this club. So today's topic, which we're discussing, is empathy, and we would really require your participation in that, because this topic is like our other topics where we discuss about a syndrome and where we talk about a lot of factual things. uh, there is a right and wrong answer in that case. In most of the cases there are differentials which are very scientific, and uh, at times it's very technical, and it's very broken down into numbers, percentages, inheritance patterns. But the thing which we're going to talk about today is going to be empathy, which is a very quantitative emotion, and it's a very powerful tool that genetic counselors use in their sessions. And we are going to talk about this empathy through a paper which analyzes and assesses empathy in students and professionals to see how it evolves uh, through training, and how it is passed on in the professional space through our training. And as genetic counselors, I think it's very important for us to acknowledge that and talk about it, because the more we understand empathy, the more we realize uh, how we can use it effectively in our sessions, and how we can keep on working on it throughout our professional journeys. So this paper kind of possesses an important question, that should empathy be uh, evaluated for genetic counselors in student phase and also in professional space, and how it can help us to gain insights whether or not the profession is working at its optimal level. By optimal level, I mean is to say that are we really, when we say about genetic counseling, we often bring up this term that we provide an empathetic space to our patients. Sorry we help the patients to understand the medical diagnosis, and we are there to help them to cope with that diagnosis. So is it really is it really necessary for us to assess our own empathetic scale and see if it is having any reaction on us, and what are the other things that can arise when we are exposed to empathy uh, in more than usual volume, and how we can work on to see that we are not uh, what do we say, we are not facing any kind of burnout, or we are not facing any kind of adverse effects, and how we can avoid reflection of those adverse effects on our patients and our sessions. So we'll start with the presentation and see what we can gather from this paper, and why is it an important thing to talk about it. Are you guys able to see my screen?
Yes, it's visible.
Okay. So we are going to talk about this paper, which was a study by University of Wisconsin, and also it was done across a few states in the US on the eastern coast. And the study was targeted for genetic counseling students, which is like a 2 years course in the US after bachelor's usually. And they have explored empathy in genetic counseling students who are who are pursuing that degree, and also in professionals who are working as genetic counselor in different settings. And they have really tried to see how to qualify and quantify this emotion. So the agenda would be introduction. We will be exploring empathy and sympathy and methods of study and key takeaway with conclusion of the study. So let's talk about introduction. So before the slide, can any one of you tell me what is empathy for you? What do you understand by the word empathy? Anyone?
Think for me. No, no, it's okay. Go ahead, Mrinal. You speak. It's okay.
I feel the ability to feel other person's feelings is called as empathy.
Okay, great. We That's true. Uh, Anyone else?
I think empathy would mean that to understand the other person's point of view.
Great. Yes, it
Uh,
makes sense. Yeah, go on.
yeah, so I think it's like we got to be in their shoes and try to feel what their point of view, exactly what they're trying to say.
Mm-hmm. Okay. Anyone else would like to try? Okay.
And I just want to add one thing.
Mm-hmm.
Empathy is something that we, like everyone has said, it is like understanding other people's pain. And not, you can say, we are trying to divert him on a point of view, telling or directing him that whatever he's feeling, right or wrong, but just understanding and listening and then lending the ear, and then based on the clinical facts making him what is all he about feels, how right it is and how wrong. So the agenda of empathy is, from my point of view, is that just a little bit different.
Okay, great. Excellent definitions we had. Like, yes, it is kind of lending an ear, listening to the person's point of view, and kind of feeling the emotions what other people are going through. That would be a patients in genetic counseling case. And the focus is really on the emotions, what they're going through, and listening that perspective, taking that perspective. So great. So we'll move into the technical definition. It is like is a complex concept which is defined in many different ways over time. It is an important trait where we kind of understand the emotion, take the perspective, and this paper basically introduces empathy as a feeling wherein we try to focus on the person's emotions, our patient's emotions, and make sure that we are able to accept the perspective, and we are able to relate with the emotion rather than just the experience. Like, for example, if the patient is talking about a certain loss, pregnancy loss, or uh, losing somebody to a certain disorder, so we are trying to really relate to emotions beyond the situation. That would be grief, that could be some kind of guilt or shame associated. We're trying to really deal with those emotions rather than just the incident. And why was this important for them to assess in this paper was because it is very complex concept, and like we all had different idea of empathy, different way we perceived it. So exactly, it says that there are very different terminologies and different ways over time where in which empathy has been explained. So it is a really widely accepted trait in healthcare. Anywhere you go in hospital, wherever you're placed in the healthcare system, you having empathy is very important. Empathy remains a key uh, tool or a key emotion or a forte one can process in the industry. So, research, whatever little research has happened, it has shown that over time, empathy levels decline in healthcare professionals. And these healthcare professionals, when they have declined empathy, it could have an uh, adverse effect on the healthcare system. And these declines have been noted right from the the time when they are taking the education till the time they are in the field. So this study wants to challenge the loopholes or challenges that might be there present during the education process or transitioning to work process, to see where we can handle this fatigue or these loopholes better and keep that empathy level intact in the professionals. So understanding empathy in technical way, empathy has two main components. It is a cognitive component and affective component, and together they bring in empathy. So the cognitive component is really connecting with individual by attempting to understand their suffering or distress, like going beyond just the incident and understanding what the incident might be causing emotion in them, the emotion that is coming. We focus on that. We try to go beyond just the factual details the patient is giving, and we try to really connect with them on an emotional level. So this is what cognitive component of empathy means, and it is very important because in this cognitive component you need to have an understanding of identifying emotions. Your vocabulary in terms of emotional labeling should be kind of enhanced and nuanced. In terms sadness, happiness, there's a very beautiful picture online which says about different shades of emotion. It is a very common picture used in genetic counseling classes, wherein they say that the happiness, sadness, anger, and grief are like very basic emotions, but they could be giving rise to a lot of other different emotions, which could be guilt, shame, confusion, coming from a place where they're not having enough knowledge, and that is why it is creating them to feel maybe angry. Uh, Anger could be also because of they are going through something that is very traumatizing, or that is very that is just the grief that is translating into anger. So that is why it is important for us to have that emotional vocabulary wherein we know what we are labeling it, because this is what really will mean the having that cognitive component alive, wherein you know what emotion you're talking about. Because at times if you mislabel it or you talk about in a very broad sense, patient might not able to relate with it, or patient might feel that okay, I'm not understanding. So it is very important for us to have that um, presence to clarify with patient if we have mislabeled it, and also to take it through patient's point of view rather than just going on with our point of view. So yes, it is really meaning that you attempt to understand the suffering and distress, also relating to the emotions by evoking response in self on an emotional level. So basically this means that this is the affective component wherein you revoke basically emotional response. So it is not like we are trying to imagine ourselves in that incident, but we are trying to relate to that emotion. So for example, anger, you're trying to relate to the anger and patient, so where you are kind of imagining uh, what had made you angry and how you felt about that anger. It is it is just not about like the incident, it is about that emotion. So you try to relate that emotion, how it felt for you, so that you know how you can relate to, you kind of increase and relatability factor with the patient. So let's come to the big confusing component that comes with empathy, that is sympathy, which we see commonly used interchangeably. So anyone like would like to give examples where we might conflate empathy with sympathy?
I would like to add something. For sympathy, it's like, as you said, Mahesh, understanding, or you can say, um the response of caretaker or maybe patient for the diagnosis or grieving or loss, tackling it in a tactful way in which patient or caretaker is not feeling guilty or having a mental breakdown, and supporting him in his current situation or maybe for a relative period of time is sympathizing. It cannot be like a one term one session thing, it has to be continuous, what I have felt. So I don't know how is everyone's experience here in that terms, but
Mhm.
that is what I feel. If I'm wrong, please correct.
Yes, I think if I understood it correct, it's like holding the space, empathetic space for your patient every time they come. Is that right?
Yes.
Great. Yes, I would agree from a personal experience that yes, holding that space every time the patient is there is very important, because that's how you will mm, be able to revoke empathy. And if you feel that the space is not there, then it might be because you're leaning towards sympathy. You might feeling bad or something on those lines. So
Yes.
to go with what empathy versus sympathy really is, it these are not two very similar emotions, but in turn they are very contrasting emotions, and they are often confused with each other. Sympathy is experiencing another's emotions rather than just imagining those emotions. It is uh, so basically it means that the best example of sympathy would be you go for a movie, you watch a very heartbreaking scene, and you start crying, and you have an emotional response there. So it is more of that in a setting, or like where, for example, in when your patient is talking about grief, and you start experiencing that grief on a personal level, and you start experiencing the same emotions instead of just reflecting or understanding that emotion. It is kind of sympathy, and this might lead you to feel sad or feel pity for your patient, and that would make that would kind of not be an ideal situation in a counseling session, because you will be feeling sympathy, you will be feeling bad, which is not the case, which should not be the emotion ideally in a setting. Whereas empathy is considered, it's a combination where you acknowledge the suffering, as in, you know that yes, you accept that there is suffering, you see the suffering, you see the emotion, and you resonate with your patient. You don't experience the same emotion, but you resonate it. And the focus while doing that is on patient, it is not on you, which exactly happens in sympathy, whereas focus also is on you. More of a Sympathy is defined as more as a self-motivated response rather than a person-centered response. In sympathy, you don't accept the situation or the emotion, but you start experiencing that emotion on a personal level, which is because of a personal incident. And in this way, you bring in your own narrative also in the picture, which is not ideal, wherein it's not an empathetic exchange, it becomes sympathetic exchange, wherein you feel with the patient the same emotions. But empathy is like observing those emotions, accepting those emotions, accepting that situation in patient. For example, to give example, there might be something that patient says which you might not be able to accept completely. You might be like, okay, for example, if somebody wants to take a decision on the pregnancy, and you feel that, oh, how can they do that, or that might be leaning towards sympathy. But empathy is that accepting it and saying that yes, this is something that is is good for patient, and I'm here to support them through this decision. And when you get to that emotional level, and you resonate on emotional level, not just on the incident, not just on the decision, it is how this is how empathy will look different than sympathy. And the important component of empathy would still be accepting the situation, accepting the emotion, and not bringing a self motivated bias. When empathy will often put us in cross sections with having meeting our own biases, meeting our own prejudices, but how you work with them will enhance your response. And if we try to center it through our bias or through our prejudice, then it will lean towards a sympathetic session, sympathetic approach, which might not benefit the patient. And any questions, anything somebody would like to add to this?
So I had a question.
Okay.
So as you said regarding the pregnancy decision, that sometimes you may agree to the patient and sometimes you may not. Then
Mhm.
what should play the important role in this? Empathy should play an important role, or the sympathy which you feel for the patient should play an important role while you are taking a decision?
Okay, what do you mean by you're taking a decision?
You are taking the decision that yes, I'm supporting the patient, I'm telling them what is good and what is bad in the pregnancy case, but
Mhm.
you are not entirely convinced. Then how you're going to make your mind convinced that yes, I have helped them, now it's their decision?
Okay, so when we that's a very excellent question. So when we talk about accepting the emotions, right? In empathy, we often say accepting that person and that emotion. So when in a pregnancy, you feel that okay, this is the decision they are making, and you might not be fully convinced with it. Okay, so
Yes.
that could be our own personal bias and our personal opinion that regarding that. For example, uh, there might be just what do we say, for any n number of n number of reason they are going for
Yes.
an abortion, or they're going for a, which you feel that okay they can continue, they can see. Or if there's a person or a pregnancy where they have a T21 high risk and they have found a T21 diagnosis, but the patient still wants to continue even though it's a high risk pregnancy, and it's going to probably end up being a lot more what do you say, burdensome for the patient. But in this case you need to understand we are there to support them in their decision, and we are there to provide them best options which are suitable for them. So again, it is going to be a person centered response. When we start a taking session, or when we start relating to the situation and we start saying them from point of view that okay, I think this is not right, this is not wrong according to me. And
Yes.
even if the patient is saying that okay, no, we would like to continue, and you start giving them options like no, I think you should abort this child, your next child is going to have a very low risk, so you should think about that. So that would be
Yes.
where you take away the patient centered agency and you start uh, talking from a
Um,
place of bias.
yes.
So
Thank you.
okay, I hope it
Yes.
answers your question.
Yeah, it's clear.
Great. So yes, keeping your session as per the patient's emotion and patient's decision, and making sure that whatever emotions you're uh, expressing or you're reflecting back are of patients, and they're not coming from a place of bias in you. And yeah, so that is how you can keep your session empathetic. And this also will give you a feeling that yes, we did what was right for the patient, what was best for the patient. And this is how it will make you make peace that okay, yes, we did good for the patient, it benefited our patient. Like in genetic counseling, the four pillars which say autonomy, confidentiality, beneficence of the patient, and no malpractices with the patient. So we also, by being empathetic, support this autonomy of the patient, and also make sure that the whatever session we give is beneficial for the patient, not just for us. Okay, so I hope that answers the question and clears it out. So in this study, what tools they had used were interpersonal reactivity index scores, which were talking about empathetic concerns, which was again sympathy versus empathy, perspective talking, another point of view, and fantasy, wherein you imagine the situation and relate to that. They had used these tools in a way where to see if genetic counseling professionals and students are able to identify emotions which might be sympathetic or empathetic, and how they choose to be empathetic, how they choose that okay, their response is going to be empathetic. And perspective talking is when they talk from point of view of the patient, and they accept the point of view which the patient is expressing, wherein they don't bring in their own bias, or where they don't talk from a place where they are being non-directive, where they're kind of taking the narrative as per their own bias or their own feeling. So perspective talking, it really means that accepting that patient's point of view, where they're coming from, and making the session beneficial for the patient, and nowhere making it about a self motivation in us, and keeping it centered to the patient. Fantasy, they had used this tool to see how the genetic counseling students and professionals were able to relate with fictitious characters, and this helped them to understand if the genetic counseling students and professionals had an imagination scale where they could imagine the emotions. This was also important for them to see that, because a lot of times when we say in a session that I understand or I completely get your point, it might make the patient feel that okay, if they're understanding, then they should give me an answer, or they should give me an uh, what do you say, a solution then and there. But when we use a simple statement like I can imagine, or I can imagine how difficult that must be. It just says that we are able to imagine, we are able to relate with it, and it kind of makes a difference where we can put them that we imagine. So these are the ways where we can help you, where we can support you, and this is how we are going to help you. And this also gives us kind of an way where we can tell them that okay, we might not be able to like provide you with a solution, but we can provide you with options that you might choose which is best suited for you. So yes, fantasy plays an important role there. Also, they had used a personal distress scale for the professionals to see after sessions or when they are in continuous sessions where they are exhibiting empathy, where they are exhibiting compassion. Is there any distress on them? Is there any anxiety or stress response in the person who is providing this service? And also advocacy work, wherein in a lot of schools in the US they require professionals and students to have an experience of working in crisis counseling, in emotional distress helpline, in agencies where they are required to sorry provide emotional support to individuals in distress, to see if they are able to uh, they're able to support people in distress, and they're able to bring a certain skill set where it could be really useful when they are dealing with patients who might be going through distress or who might be going through a certain difficult emotional status. So advocacy work, how it plays a role. So the results and conclusions were that there was a decline in empathy levels seen in second years and in professionals than in first years. And as a result, there is a compassion fatigue. So does anyone know what compassion fatigue means?
Compassion fatigue means overwhelmed, overwhelming situation for doing overwhelming thing which you are very compassionate about. Like if you are very compassionate about patient advocacy, but there will be a point where you will be tired doing good also. It will not decline your you can say compassion, but that compassion is affecting your mental health, and maybe that compassion is affecting your mental health, and maybe that is causing fatigue, which is affecting your emotional balance, which is affecting your personal life of that sort.
Components in us, and how we can do it is with standardized training, wherein there is there is kind of an effective tools which we have in place where we know how we are tackling our compassion fatigue, and how we are kind of talking about our emotions and kind of having a boundary between our work and personal life, wherein after a session you offload any pressure at work, you don't take it back with you, you don't take an emotional response back with you. And when you have an emotional response stayed with you, you kind of not need to be cognizant enough that okay, you need to have that awareness, okay, yes, this has stayed back, and for that also you need some support who might help you to realize that. So again, having a strong empathy training wherein you be empathetic to yourself also, that is an important thing here which highlights, is that you have certain interventions for yourself also after a difficult session. You take breaks, you take uh, kind of have strong boundaries with your professional and personal life, and this will help in reducing the compassion fatigue and also building resilience in genetic counseling programs, which will help in maintenance. So resilience is a very another important emotion wherein we bounce back, or where we kind of grow through what we are going through. And it also says how we respond to difficult emotions in ourselves. So how we take care, self-care, and having a time off for ourselves, taking frequent breaks from such an emotional charged profession. That is why it is important. So does anyone see any tools which they use or any self-care habits they use professionally to take care of their compassion fatigue? Or are there any tools which you use for boundary setting? I would love to hear that.
One thing which can be done. Okay, someone else raised their hand. Let them answer. I'll answer some.
Yes, go on.
The thing for tackling compassion fatigue is like, not overpowering yourself with the work or the patients, considering that, no, I can do more and I can put more effort, because there will be a time, as I told, like for a month or a two, you will overwork and you will be happily doing. But then, as Mayuresh told, that empathy and the counseling becomes more of a scripted rather than as a part of compassionate work boundaries, timings of the work play a very important role. If you keep yourself available for all the time while working, it will definitely take a toll on your mental health. And I'm saying this because of a personal experience. So I have started limiting myself. We are not here to prove that, I can do number of calls today, I have done more calls today. The quantity of the calls or counseling is not important, because if you are doing more, you are setting some expectations for the counterpart also, for the team or maybe organization, that nahi, nahi, she can do it more. But at a point you will break down, and then it affects your productivity and the compassion of the work. It will be like, no, no, chalo kar lete hai, itna sa hai to. That should not happen, because we are not in the profession that, दो screw fit कर दिए तो आदमी ठीक हो जाएगा. We have to be available from every perspective to the patient. So it is not something we can do it in a mechanical manner. It has to be a holistic. So following the hobbies, also one more thing which adds, reduce the compassion fatigue, is like hobbies. At least whatsoever work you are happily doing, like someone likes working out, someone likes to do yoga, someone likes reading the stuff which is not related with our work, or painting or music, attending music classes or dancing. So hobbies play a very much important role in keeping you fresh and, tackling the compassion fatigue.
Yes, very rightly said, Ruchi. Uh, there could be multiple ways to cope with work stress, and having a balanced life outside work, and having strong work boundaries again. Like if you have an emotionally charged session, you take breaks, you make sure that you log off from your work in a timely manner on that particular day. You give time for yourself to sit with your emotions and talk with somebody who you might be your professional colleague or your senior support. And also you talk with your friends. You might not talk about the patient details, but talk about how you're feeling in general. And it is important to address that. Also, as colleagues, we need to support our colleagues who might be going through a difficult session. And here is what makes genetic counseling different, because we being empathetic. So I think there's one beautiful thing which I had discovered when I was discussing having an offloading session with my senior, was that if we cannot be empathetic with each other as colleagues, we cannot be empathetic with our patients. So if you want to be empathetic with your patients and improve that, you need to be also equally empathetic towards your colleagues and provide them also that space wherein they can talk about their difficult emotions with you, and you can support them in their difficult time or distress. So yes, and having hobbies and having a balanced life outside work always helps. A lot of people in community that I know, they often resort to having hobbies like music, painting, maybe something like Nivedita was on the session she had, so something like gymming, hitting the gym, exercising, physical movement can be a great thing. It might work for somebody. Journaling can be a great thing to keep and tap on our emotional health and how you reflect on those journals. So yes, thank you, Ruchi, for adding these points. Anyone else would like to add something? Okay. Yes. Yes. Thanks, Shada, for saying that. Yes, you genetic counselors, students, and professionals who are in this space can use this as a medium to talk about their difficult emotions, and we will try to support you the best. So, moving ahead, there was also a beautiful thing this paper spoke about was role of advocacy experiences. So advocacy experiences is basically a crisis helpline or a counseling service wherein you work with people in distress or emotional, uh, going through difficult emotions, or it could also be working with a support group dedicated for a certain genetic condition where you deal with patients as an advocate and not as a genetic counselor necessarily, wherein you try to advocate for their rights, their basic what do you say basic well-being, and try to work towards increasing quality of life for those individuals. It kind of reflects back well in your genetic counseling career, because they could see that people who had worked in advocacy for more time, like for 6 months to a year, they showed lesser levels of stress and they had better coping mechanisms in place. So this advocacy uh, experience, like a suicide helpline or a crisis counseling helpline, a emotional support helpline, they will oftentimes have these offloading sessions, and they will oftentimes have sessions wherein you will be taught how to uh, take care of those difficult emotions, how to talk about them. There'll be people, professionals, who will be questioning you after a difficult shift or a difficult session. So this kind of gives you an idea of how you can translate that space into genetic counseling setting, how you can have a space in genetic counseling setting wherein you talk about difficult emotions, where you went out, where you take help of some senior, some colleague to deal with those emotions. And that is why engaging in advocacy work over a longer period allows uh, the candidates or professionals to build resilience. Again, resilience was an important emotion to cope with compassion fatigue and deal with a decline in empathy. So you can build resilience to advocacy experience. And so yes, this all the more highlights a reason for us to go through advocacy experience even as professionals. And if you're planning to take up genetic counseling as profession, advocacy experience could be a great place to gain insight on how you can support yourself emotionally while giving that emotional support to others. So the summary is that it is important to assess empathy and evaluation of empathy in uh, genetic counseling spaces, because this will not only benefit the genetic counseling students in the career, but will also prove beneficial to the individuals and the family members who come to us. And it will also help us to uh, kind of benefit our community of genetic counselors. And this is going to be this assessment will help us to be wholesome genetic counselors, and kind of provide an holistic care or a holistic counseling session to our patients. So this is the summary, and this is why we, as on personal level and also on organizational level, we should have these assessments for us. And even if you're a student, even if you're a professional who is entering this space, uh, like recently, you need to have some tools at your disposal to know how you can address your own emotional distress, and how you can make peace with that empathy is going to look different in every session, and how you can enhance it and keep it going for next session, and also to deal with compassion fatigue and emotional decline that might be in you. So this beautiful Brené Brown quote I would like to use to close the session, like, if we can share our story with someone who responds with empathy and understanding, shame can't survive. And I think this is very powerful. When we say that as genetic counselors, we want to tackle the stigma, or we want to kind of address the stigma associated with genetic disorders, stigma associated with expressing emotions, we need to keep up our empathy, and we need to enhance our understanding of empathy itself. And when we club this understanding of empathy with our medical genetics knowledge, is when we can have an effective counseling session and be truly empathetic. And that is how the shame won't survive. And hopefully, we'll be better advocates for our patients and benefit our patients to a greater extent. So, by saying thank you, and the session is open for you all to discuss.
I think first of all, thank you very much, Mayuresh, for explaining everything so nicely. And it was an amazing session. It was an amazing topic. And I think even not just in genetic counseling, this especially compassion fatigue is like applicable to any profession or any field that just has you following what you're passionate about. So it was a very informative session too. And I'm glad that so many new people could join.
Thank you, Sukriti, and thank you, Shraddha, for sharing your thoughts. Anybody else would like to share their thoughts and reflections from the session, from their understanding of empathy or compassion fatigue? Thank you for
Hi,
joining.
Mayuresh. Uh, Hi, Mayuresh. So
Yes,
yeah,
yes.
first of all, I would like to congratulate you. Okay, and yeah, this session was very informative and it was very good. As I said, I'm just entering in this profession, and I'm not like I've never counseled like genetic counseling. I've never done that directly, but I've observed the case. So whatever you said throughout the session, I was able to relate it through something like I do crisis counseling thing. So I've just started since a month, and yeah, the this compassionate this fatigue thing. I went through all of that so many times, and as you said, no, we discuss if we discuss with your colleagues and all, it makes you feel better. And I did that, and yes, it made me feel better. And I was while you were talking all of that, I could relate everything. And yeah, I want to say, okay, thank you so much. Okay, it's gonna help me not in just in my genetic counseling thing, but anything, even as somebody's told here in personal life or anywhere else. So yeah, that is what I wanted to say. Thank you so much. Thank you so much. It was such an amazing session.
Thank you so much for sharing, Dipali. And yes, thank you for saying that yes, it makes a difference. We do take back some parts from our profession in our personal life. They do translate, and when they translate in a good way, it obviously benefits us. And if they benefit us personally, we can provide or prove professionally in a better way. So thank you for sharing those reflections, and all the best for your advocacy work you're starting. So great. Hoping
Thank
to
you.
hoping to hear more experiences from you and getting learnings from you.
Thank you so much.
Mrinal, you were saying something.
Yes, as I said, I'm quite new to this aspect, but the way you explained, I was so intrigued that I will go back and I'll learn more something about it. Thank you so much for this informative session. I really loved it.
Thank you so much for sharing your review. Thank you. We're glad you joined, and yeah, hoping to see you for future sessions as well.
Yes, sure.
Yes, that. And before we just end the session, I'd like to just put it out there that next week we'll be having a few Australian genetic counseling students who are currently in one of the programs there, and they'd be telling us about their process and their journey in becoming a student, in becoming a genetic counseling student in Australia. So anyone who's interested in that, just knowing about it, just knowing the process, just knowing their journey as international students there, they're very much welcome to join. And of course, please share it amongst your friends also, and your classmates and your colleagues and anyone who would be interested in knowing about it. So we'll of course be sharing all of the details online on all of our social media platforms as well. So just please make sure to share it with the ones who you think would be interested, even if you might not be. So just that from my side. I definitely agree with you on that. I completely agree with you on that. If at all our even one of our sessions or any sessions are reaching students, we're very happy with it and we're very glad. And we want all of this information that we're putting out there, all of the meetings that we have, the sessions that we have started having with industry professionals, and now next week with current genetic counseling students as well. We Our main focus has always been to provide a platform for the current, prospective and future genetic counseling students in India to just relate to their experiences and just have a platform to know about genetic counseling, and rather than not knowing who to reach out to. So we're very glad that students can join in, and we'd be very happy if you can just again share it with more of your friends as well.
Thank you so much. It's a pleasure. Yeah, I mean, I've heard the whole, like, I've listened to and seen BTech student, I mean, biotech students like Brunal joining in this. Yeah, it is very happy. And I'm a student myself, so me also listening to a lot of experienced people and an intern, Dipali, it's like, yeah, it's the experience is unmatchable, not something we get in the books, like study.
Thank you for praising me, but I will definitely say I have attended more conferences regarding the biotech fields and genetic fields, but this was the best interactive session I have ever received. So thank you so much.
Thank you so much for sharing your review, guys. But yes, we would love to have you guys more often on these meetings and the lectures which we're arranging, like Sukriti and Shraddha told. So we hope to see you in huge numbers because we really want this community to grow, wherein you get to talk about genetic counseling without any labels, like labels of being associated with some organization or being from a place, but talk about genetic counselors as genetic counselors or prospective students and get your doubts solved and start your journey. We would be very happy to support you in your journey and to provide you this platform for you to network in the beginning of your journey with professionals, with students, with interns, or even with somebody like a prospective, so like Mrunal, she is from biotech, or somebody like Dipali who's interning, or somebody like Soham who is a professional genetic counselor. So please interact and we'll be glad to see you. So like we said, next week we are having a informative session on genetic counseling by Australian genetic counselors, and we try to bring in focus on genetic counseling of a global standard as well. So looking forward to meeting you all in that session and also in journal club meetings where we'd be discussing different syndromes, different therapies, and also uh, emotional and psychological and psychosocial part of genetic counseling like we did today. So yeah, once again, thank you for joining. It was nice having you all and talking to you about empathy, which is a very close topic to any genetic counselor, I'm sure. So yes, thank you for joining in. And thank you, Sukriti and Shraddha, for your support.
Thank you for conducting the session, Mayuresh. It was very nice. And then have a good weekend.